Good morning. Thank you, everyone, for coming. We're going to get started. I'm Rachel Mertz with the Medical Society of Virginia. Today we're releasing data from a statewide survey of Virginia physicians related to the impact of potential Medicaid cuts on Virginia's patients. Our goal was to gain a sense of what the impact of cuts might be should the General Assembly go forward with that this year in the budgeting process. We sent the survey to over 5,000 physicians, and the responses that you're going to hear about today are based on over 560 responses from all parts of the state. In the release that is available to you today are specific data points that will provide more detail for you on what Dr. Epps, who is our president, is going to talk about right now. So I'd like to welcome Dr. Epps to the podium and turn you over to him.
Thank you, Rachel, and good morning to all of you. Virginia physicians continue to be concerned about the impact of potential Medicaid cuts that would have upon our patients and patient access in the state. These turbulent economic times will find ourselves as in real trouble as they increase the number of our fellow citizens who will find themselves out of work, unable to cope with COBRA payments, that they will become uninsured, people who will turn to the state's Medicaid program to help them in this time of health care needs. These folks, in addition to the thousands of children, elderly, and disabled who already depend upon Medicaid for their complex health care needs, are exactly the people that would be hurt the most if Medicaid physician funding is cut. Virginia currently ranks 48th out of 50th in the United States as far as Medicaid funding. Physicians who currently treat Medicaid patients frequently do so at actual cost or even below for providing that service. Unfortunately, physicians are business owners and employers, and in difficult times of an economy like we have right now, physicians must consider the viability of their practices and whether they can continue to serve their patients. That should these, and if these reimbursement reductions become a reality, that will put us behind the eight ball, so to speak. This is a decision that physicians do not want to make. We want to continue the idealism of taking care of all people, no matter what their reimbursement levels would be. The Medical Society of Virginia wanted to quantify this, and we tapped not only our membership, but also memberships of our fellow societies and the family practitioners, the pediatricians, general surgeons, psychiatrists, and all the other people in the state that care for patients. These are the people that would, as we tried to gauge the impact upon the provider network, that would be obviously impacted if the Assembly passed cuts. Our survey only went out a week ago, and the findings, I think, are pretty remarkable, but in some ways predictable. If Medicaid payments are reduced by 3%, it's 58% will say they'll make changes to the way that they take Medicaid patients. And that is, they could reduce the number of existing Medicaid patients, they could not accept new Medicaid patients, or they'll quit seeing them altogether. Of those currently that accept new Medicaid patients, 34% said that they would stop or reduce taking new Medicaid patients. Of those who currently treat Medicaid patients, 48% said that they would reduce or stop seeing people. A 5% cut on Medicaid physician payments would further exacerbate the problem, with as many as 68% working in some way or the other to limit how they currently extend care to Medicaid patients in the state. Virginia physicians have already been notified by one of the private sector Medicaid managed care plans that in light of Medicaid budget shortfalls, they are eliminating the $3 per member per month patient management fee for primary care physicians, and also specialists will be cut by 3%. That's anticipation of a cut that hasn't been made to physician reimbursement yet, just the anticipation. As physicians, we are greatly concerned about the health needs of our patient and ability to get the care that we know that they need. We believed cuts to Virginia's already lagging Medicaid program would increase the overall cost of providing care in the Commonwealth. Lack of access to physician care for chronic diseases or simple illnesses force people to use already overburdened emergency care facilities at a substantially higher cost than what happens in a private office, a cost that's probably about 4 times what it would take for me as a family practitioner to see someone in my office. Where there's not been specific cuts to Medicaid physician provider funding proposed, we remain concerned about the welfare of our patients and hope this data, as the Medical Society becomes a data-driven organization, that gives compelling evidence for the legislators to take into account against any reductions in Medicaid funding to healthcare providers. We thank you, and any questions?